8 common diabetes signs in women. You should never ignore what your body is trying to tell you. What if the silent changes in your body today are the very signs that could quietly steal years from your life tomorrow? You've felt it, just a little more tired, your skin suddenly drier, your clothes fitting oddly even though your habits haven't changed. It's easy to blame aging, stress, or hormones. But what if these subtle shifts are actually warning signs of something deeper, something urgent your body is trying to tell you? At Holistic Health, we believe your body speaks long before it breaks. I'm Dr. Ava Mitchell, and with over 30 years in internal medicine, I've seen how diabetes in women often hides in plain sight, masked by everyday symptoms that are easy to overlook until the damage is done. That's why in today's video, we're revealing the 8 most overlooked but critical signs of diabetes in women, like unexplained fatigue, frequent infections, strange weight changes, tingling in the feet, and even skin changes you might ignore. But we're not stopping at awareness. I'll also share powerful strategies, proven medical insights, and real stories from women who turned their health around. So, if you've been feeling off lately, this might be more than just stress. Stay with me, because what you learn today could save your health tomorrow. 1. Frequent urination and thirst. What's really going on inside your body? You might assume that frequent trips to the bathroom or constant thirst are just side effects of drinking more fluids or trying a new herbal tea. But if this pattern continues, especially if you're waking up at night to urinate, it could be an early and often overlooked warning sign of diabetes. What's really happening is that when your blood sugar levels rise, your kidneys work overtime to flush out the excess glucose. In doing so, they pull water from your body, which leads to dehydration. Your body responds by signaling you to drink more, setting off a frustrating cycle of constant thirst and urination that never truly feels resolved. At first, it might be subtle, an extra glass of water with lunch, then needing to use the bathroom more frequently, then finding your sleep interrupted by nighttime urges to go. It sneaks up quietly, but it's a powerful message your body is trying to send. I remember one of my patients, a 47-year-old woman, who dismissed her frequent urination as just a normal part of aging. When we ran her labs, her fasting blood glucose was over 180 milligrams per deciliter. She was diagnosed with type 2 diabetes. Thankfully, with the right care plan, her symptoms improved within weeks. The key was catching it early. So, what should you do if this sounds familiar? Don't brush it off. Ask your doctor for a fasting blood sugar test or an A1C test to check your average glucose levels over the past 3 months. Stay hydrated, of course, but know that no amount of water can fix what's really a blood sugar issue. And most importantly, don't accept nighttime urination as just a part of getting older. When your body speaks, it's time to listen. Early action can make all the difference. 2. Yeast infections. A warning sign. Women must not overlook. Recurring yeast infections might seem like a minor inconvenience, something you chalk up to stress, tight clothing, or changes in your hygiene routine. But if they keep coming back, especially without an obvious cause, your body could be signaling a deeper issue: elevated blood sugar levels. Many women don't realize that persistent yeast infections are often one of the earliest and most overlooked signs of diabetes. Why? Because yeast thrives in high-sugar environments. When glucose levels in your blood are elevated, it can also affect your vaginal tissues, creating the perfect breeding ground for yeast to grow and multiply. This imbalance can lead to itching, burning, discomfort, and thick discharge that just doesn't seem to go away, even after rounds of treatment. The truth is, while over-the-counter antifungal creams might provide temporary relief, they won't stop the infections from returning if the root cause, unstable blood sugar, isn't addressed. I've had patients come to me after suffering through 3 or 4 yeast infections in a matter of months, frustrated and embarrassed. In many of those cases, testing revealed pre-diabetes or even full-blown type 2 diabetes. Once we focused on balancing their blood sugar through diet, medication, and lifestyle changes, the infections stopped coming back. So, if you're dealing with more than one yeast infection every few months, don't just treat the symptoms. Pay attention to the bigger picture. Talk to your doctor about getting a blood sugar test. Wear breathable underwear, avoid excessive sugar in your diet, and prioritize hydration and hygiene but know that true healing starts from the inside out. Yeast infections aren't just a surface-level issue. They're often your body's early cry for help. Listening now could prevent more serious complications down the road. 3. Polycystic ovary syndrome, PCOS, the hidden metabolic. Link, polycystic ovary syndrome, or PCOS, is often seen as a reproductive disorder, missed periods, unwanted facial hair, fertility struggles. But what many women don't realize is that it's actually a powerful metabolic warning sign. At its core, PCOS is deeply connected to insulin resistance, a condition where the body struggles to use insulin effectively. This not only leads to higher blood sugar levels, but also sets the stage for type 2 diabetes down the road. The connection is so strong that many women with PCOS already show signs of prediabetes without even knowing it. What's happening internally is a hormonal imbalance triggered by excess insulin. That excess insulin causes the ovaries to produce more androgens, male hormones, which disrupt the menstrual cycle and lead to acne, weight gain, and even thinning hair. But the most concerning part is what you can't see: your body's slow but steady march toward full-blown diabetes. I've had patients in their 20s and 30s come to me for irregular periods or trouble conceiving, only to discover through lab tests that their blood sugar levels were already climbing dangerously high. The earlier we catch it, the better the outcome, not just for reproductive health, but for long-term heart health, liver function, and more. If you've been diagnosed with PCOS, don't stop at treating the symptoms. Dig deeper. Ask your doctor for an A1C or fasting glucose test. Focus on a lifestyle that supports insulin sensitivity. Choose whole, unprocessed foods, stay active, get quality sleep, and manage stress. In some cases, medications like metformin can help regulate both insulin and cycles. But most importantly, recognize that PCOS isn't just about your ovaries. It's a red flag from your metabolism. Ignoring it means missing a chance to prevent diabetes before it begins. Listening to your body now gives you the power to protect your future. 4. Unexplained weight loss or inability to lose weight. Two sides of the same coin. Weight can be a sensitive subject for many women. You might feel proud when the scale drops unexpectedly, or frustrated when it refuses to budge no matter how hard you work. But here's what most people don't realize. Both unexplained weight loss and the inability to lose weight, despite your best efforts, can be two sides of the same metabolic coin. And that coin could be diabetes. If your weight is changing in ways that don't make sense, your body might be trying to tell you something important. Let's start with unexplained weight loss. While it may sound like a dream for some, when your body starts shedding pounds without any lifestyle changes, it's a serious red flag. In uncontrolled diabetes, especially type 1, but also in advanced type 2, the body can't properly use glucose for energy due to a lack of insulin or insulin resistance. When your cells are starved of glucose, your body begins breaking down fat and muscle to compensate. This leads to rapid weight loss, but not the healthy kind. Alongside the pounds you also lose strength, energy, and often your sense of well-being. On the flip side, if you're struggling to lose weight, despite eating well, exercising regularly, and doing everything right, you could be dealing with insulin resistance. This means your cells aren't responding effectively to insulin, so your body produces even more of it. High insulin levels promote fat storage, especially around the abdomen, and make it incredibly difficult to lose weight. It's not about willpower, it's about biology. And until you address the underlying issue, typical weight loss strategies may continue to fail. I once treated a woman in her mid-40s who was doing everything she could to drop 15 pounds. Strict diet, daily workouts, even fasting. But nothing worked. After a simple blood test, we discovered she had prediabetes. Once we adjusted her diet to focus on blood sugar balance, adding more fiber, protein, and healthy fats while reducing refined carbs, she started losing weight steadily. Her energy improved, her cravings disappeared, and she finally felt in control of her body again. So, if your weight is changing for no clear reason, or not changing at all when you're putting in the effort, it's time to dig deeper. Ask your doctor for a fasting glucose test or an A1C to assess your average blood sugar levels. These simple tests can reveal a hidden metabolic imbalance that might be silently sabotaging your progress. In the meantime, focus on nourishing your body instead of punishing it. Choose whole foods over processed ones, prioritize lean proteins and healthy fats, and avoid skipping meals, which can cause dangerous blood sugar spikes and crashes. Add strength training to your fitness routine to improve insulin sensitivity. And most importantly, shift your mindset. Your weight isn't just about numbers, it's about what your body is telling you. When you listen to those signs early, you give yourself the best chance to take action, restore balance, and protect your health for the long haul. 5. Crushing fatigue. When sleep isn't the solution, fatigue is one of the most common complaints I hear from women in my practice, but it's also one of the most misunderstood, especially when it comes to diabetes. We've all had days where we feel a little tired, worn down, or in need of an extra cup of coffee. But there's a difference between being tired and being completely drained of energy, no matter how much you sleep. If you're waking up exhausted, dragging through your day, and finding that even basic tasks feel overwhelming, it's time to stop blaming stress or aging and start looking deeper. This kind of crushing fatigue could be a red flag that your blood sugar is out of balance. Here's what's happening behind the scenes. Your body needs glucose to produce energy, and insulin is the hormone that helps deliver that glucose into your cells. But in diabetes, this process is disrupted. Either there isn't enough insulin, or your cells are resisting it. That means all that glucose stays stuck in your bloodstream instead of being converted into usable fuel. It's like trying to start a car with a full gas tank but a broken engine. The fuel is there, but your body can't access it. So you're left running on empty, physically, mentally, and emotionally. This form of fatigue is often persistent. It doesn't go away after a good night's rest. In fact, you may find yourself sleeping more than usual, but still waking up feeling foggy, unmotivated, or emotionally flat. You may have trouble concentrating, experience mood swings, or feel a heavy sense of burnout that no amount of coffee or naps can fix. I've seen countless women, mothers, professionals, caretakers, push through this kind of exhaustion for months, even years, without realizing it's rooted in something more serious than stress. And when we finally test their blood sugar, the numbers speak for themselves. If this sounds familiar, don't ignore it. Start by tracking your energy levels and when the fatigue hits hardest, often after meals or in the early afternoon. Then, talk to your doctor about getting tested for diabetes or insulin resistance. An A1C test, or fasting glucose panel, can give you valuable insight into whether your energy crash is connected to unstable blood sugar. In the meantime, support your energy from the inside out. Eat balanced meals with a mix of complex carbs, lean protein, and healthy fats to stabilize blood sugar and avoid crashes. Avoid skipping meals, especially breakfast. Stay hydrated, prioritize high-quality sleep, and incorporate regular movement into your routine. Even light walking can help your cells use glucose more efficiently. And don't forget the role of stress. Chronic stress raises cortisol, which in turn can increase blood sugar levels and worsen fatigue. The key takeaway? If you're constantly exhausted and nothing seems to help, your body may be struggling to turn food into fuel. And that's a red flag you can't afford to ignore. Don't wait until your body screams for help. Listen when it whispers. Fatigue could be the first quiet sign of diabetes knocking at your door. 6. Slow wound healing. A clue hidden in plain sight. A small cut that just won't heal. A scrape that stays red, tender, and slow to close. A blister that lingers far longer than it should. These might seem like minor annoyances, something you can ignore or cover with a bandage, but in reality, slow wound healing is one of the most overlooked yet important warning signs of diabetes. It's a clue your body is giving you, hidden in plain sight. When your blood sugar levels are elevated over time, they begin to interfere with your body's natural ability to heal. The reason lies in how high glucose impacts your blood vessels and immune system. Chronically elevated blood sugar damages the small blood vessels that deliver oxygen and nutrients to your tissues, both of which are critical for healing. Without proper circulation, even the smallest injury can take longer to repair. At the same time, high blood sugar also weakens your immune response, making it harder for your body to fight off infections. So, not only does a wound stay open longer, but it's also at greater risk of becoming infected. I've seen this firsthand in my patients. One woman in her early 50s came to me for what she thought was just a stubborn rash on her ankle. After a minor scrape while gardening, the area became inflamed and wouldn't heal after 2 weeks. She had no idea her blood sugar levels were dangerously high. Her A1C revealed undiagnosed type 2 diabetes. That delayed wound was the first real sign, and it ended up saving her from even more serious complications down the line. The danger here is that many women write these things off. You assume your skin just takes longer to heal now that you're older. You try creams, ointments, and antiseptics, but nothing seems to work. And all the while, your body is trying to flag you down with a message. Something isn't right beneath the surface. If you notice that small cuts, scrapes, or even insect bites are taking longer than usual to heal, especially if they're on your feet or lower legs, it's time to take action. Don't just focus on the wound, focus on what it might be trying to tell you. Ask your doctor for a blood sugar screening. Even a simple finger prick or fasting glucose test can reveal if there's something more serious going on. In the meantime, take extra care of your skin. Keep wounds clean and dry, use mild soap and warm water, and apply an antibacterial ointment if needed. Eat a diet rich in healing nutrients, vitamin C, zinc, and protein to support tissue repair. And most importantly, work on stabilizing your blood sugar through balanced nutrition, regular exercise, stress management, and if necessary, medication. Remember, wounds that won't heal are more than just skin deep. They're often one of the first outward signs that something internal is off. Don't overlook them. Your body is trying to protect you. If you listen, you can take control before complications arise. 7. Numbness or tingling, nerve damage. Isn't just for seniors, that tingling in your toes when you're sitting still, the numbness creeping into your fingers when you wake up, the subtle burning or prickling sensation in your feet that you've brushed off as bad circulation or just sleeping funny. These might not seem urgent, but they could be signs of something much more serious. Numbness and tingling, especially in the hands and feet, are often early indicators of nerve damage caused by diabetes, a condition known as peripheral neuropathy. And contrary to popular belief, this isn't something that only affects seniors. It's happening to women in their 30s, 40s, and 50s, many of whom don't even know they have blood sugar issues yet. When blood sugar remains elevated over time, it starts damaging the tiny blood vessels that nourish your nerves. Without enough oxygen and nutrients, those nerves begin to malfunction. At first, it might feel like pins and needles, a strange buzzing, or a loss of sensitivity. But over time, the symptoms can worsen into sharp pains, weakness, and even complete loss of feeling. This is especially dangerous in the feet, where unnoticed injuries can turn into ulcers or infections, sometimes with devastating consequences. I recall a patient in her early 40s, a busy professional who ignored the numbness in her feet for nearly a year. She figured it was from wearing heels all day or sitting too long at her desk. When she finally came in for testing, her A1C revealed advanced type 2 diabetes, and the nerve damage had already begun affecting her balance and coordination. The frustrating part? If she had listened to her body sooner, we could have caught it much earlier. So if you've been noticing numbness, tingling, burning, or a dead feeling in your hands or feet, don't dismiss it. It's not just poor posture, and it's not something you should wait to see if it goes away on its own. These are your nerves struggling to function, and they're warning you while they still can. Ask your doctor for a comprehensive blood sugar evaluation and a neurological exam if necessary. Early intervention is key to preventing further nerve deterioration. In the meantime, prioritize habits that support nerve and blood vessel health. Stabilize your blood sugar with a diet rich in whole foods, healthy fats, and antioxidants. Stay active. Movement improves circulation and can slow nerve damage. Take extra care of your feet. Inspect them daily, wear supportive shoes, and avoid walking barefoot to prevent injuries you may not feel. If necessary, supplements like alpha-lipoic acid or B vitamins may be helpful, but always speak to your doctor before starting anything new. Remember, nerve damage doesn't happen overnight, and it doesn't wait until you're older. If your body is sending signals like tingling or numbness, it's asking for help. Don't ignore it. You have the power to protect your nerves, preserve your mobility, and prevent a silent problem from becoming a life-changing one. 8. Skin changes. When your skin speaks, listen. Our skin is more than just a protective layer. It's a mirror, quietly reflecting what's happening deep within your body. When it comes to diabetes, changes in your skin can often be one of the first visible signs that something is off. And yet, most women brush them aside as dry weather, aging, or sensitivity to products. But when your skin starts behaving differently, becoming dry, itchy, discolored, or prone to infections, it's time to listen. Your body might be telling you that your blood sugar is out of balance. High blood sugar affects the skin in multiple ways. First, it leads to dehydration, which causes your skin to become excessively dry, flaky, and prone to cracking, especially on the legs, feet, and elbows. But it doesn't stop there. Elevated glucose levels can also weaken your immune response and impair circulation, making your skin more vulnerable to infections, fungal outbreaks, and slow-healing sores. One of the most distinct signs is a condition called Acanthosis nigricans, velvety, darkened patches that often appear in the folds of your skin, like the neck, armpits, or groin. Many women assume it's just pigmentation or irritation from clothing, not realizing it could be a sign of insulin resistance. I remember treating a woman in her late 30s who came in with persistent dryness and dark patches on her neck. She had tried every moisturizer on the market, but nothing worked. When we ran her labs, her A1C came back in the pre-diabetic range. Within a few months of making lifestyle changes to lower her blood sugar, not only did she feel better overall, her skin started clearing up as well. Her skin was trying to tell her something, long before she felt anything else. If your skin has suddenly become unusually dry, irritated, or discolored, especially in symmetrical or recurring patterns, don't just treat the surface. Think deeper. Monitor your blood sugar and ask your doctor about screening for diabetes, especially if you're also experiencing other symptoms like fatigue, frequent urination, or weight changes. To support your skin, focus on hydration from the inside out. Drink plenty of water and eat foods rich in antioxidants, vitamins A, C, and E, and healthy fats like omega-3s. Use gentle, fragrance-free moisturizers daily, and avoid hot showers that strip away natural oils. Keep an eye out for any cuts or rashes that aren't healing well, and protect your skin from sun damage, as diabetes can make it more sensitive. Ultimately, your skin is one of your body's most honest storytellers. When it changes, it's not just a cosmetic issue. It could be your earliest warning sign of a deeper health challenge. Don't ignore what your skin is trying to say. When you listen early, you give yourself the chance to act early, and that can make all the difference in preventing complications and preserving your long-term health. Before we close, let's take a moment, not in fear, but in strength. Every symptom we've talked about today, whether it's fatigue that lingers, yeast infections that keep returning, numbness in your feet, or unexplained skin changes, these are not just random annoyances. They are your body's early warning system, quietly signaling that something deeper may be unfolding beneath the surface. Diabetes doesn't crash through the door. It tiptoes in. It hides behind everyday discomforts, waiting until you're too overwhelmed or too late to take control. As women, you are so often the nurturers, the protectors of your families, the backbone of your communities. And yet, how many times have you put your health last on the list? How often have you told yourself, "I'm just tired," or "It's probably nothing," just to get through the day? I want you to know, your health is not a luxury. It's your foundation. And the time to listen to your body isn't when it's screaming, it's when it's whispering. The beauty is, you are not powerless. With the right knowledge, awareness, and small, consistent actions, you can interrupt the cycle, reverse the trend, and write a healthier future, not just for yourself, but for everyone who depends on you. That's what holistic health is here for, to guide, inform, and empower women like you to take charge of their well-being with confidence and clarity. So, if today's message spoke to you, if even one symptom felt familiar, don't let this be the end of the conversation. Let it be the beginning of something powerful. Share this video with a sister, a friend, a daughter, because we rise higher when we rise together. And most importantly, hit that like button to support this message and subscribe to Holistic Health for more doctor-backed insights, proven health strategies, and real stories that matter to women like you. Remember, your body is wise, your health is worth it, and your future is still yours to shape. Stay healthy, stay powerful, and we'll see you in the next video.